What is the state of your health? Do you have a case of male or female infertility? Have you been told you have a low sperm count? Do you have a prostate problem? Are you a lady suffering from abnormal menstrual problems? Never worry again. Zoe Fertility and Alternative Medical Center has all the answers to your health needs. At Zoe, we treat all kinds of health problems, including erectile dysfunction. Zoe Fertility Center has a state-of-the-art laboratory and an ultrasound scan services available. There's also the total body scan, which scans all your organs in 5 minutes. Yes, you heard right, in 5 minutes. Our pharmacy is well stocked with good and highly efficacious natural medicines, all without side effects. Locate Zoe Fertility and Alternative Medical Center at our Adenta new site behind the CAF International School opposite Mechanical Lloyd on the Adenta Ebri Road. At Odoko, we are near Nicolisi Hotel behind International Needs. Odoko Terrazzo. Call 0205 363614 or 0243 239534. Zoe Fertility and Alternative Medical Center. Excellent healthcare, our hallmark.
Hello, dear friends. Welcome to the Zoe Health Talk Show. My name is Dr. Fiao from the Zoe Fertility and Alternative Medical Center. The Zoe Health Talk Show is a health education program which comes your way every time. On this platform, we discuss various health issues that may be of concern to you. Today, we want to talk about ovarian cyst. Ovarian cyst. Ovarian cyst is a condition that affects women. The ovaries are part of the female reproductive system. When you take the reproductive system of women, you have the uterus, which is in the middle, and then the uterus is connected by tubes to the ovaries. And in the ovaries, you have one on the right and then one on the left. Sometimes you can have fluid-filled sacs which form on the ovaries, and so the presence of this sac of fluid in the ovaries is what we call ovarian cyst. Ovarian cyst can be normal in the course of your menstrual cycle, because what happens is that in the course of your menstrual cycle, the ovaries, the ovarian follicles are produced. As they mature, they form follicular cysts, and then with the passage of the cycle, they disintegrate, and then you go into another cycle. But a condition where you have the cyst and it persists such that it continues to be there even after you are gone through the menstrual cycle, then that is where it is a problem. And so if you have the presence of these sacs within the ovaries, and sometimes it can come in various sizes. Some are quite small, and then some can be very big. There are various types of cysts that can occur within the ovaries. We have corpus luteum cysts, and these ones normally form before pregnancy, and then when there is pregnancy, they support the pregnancy to develop, and those are normal cysts. And then we have other cysts as well. There is a type of cyst we call dermoid cyst, which also is formed within the ovary, and then sometimes they do not go with the menstrual cycle. We also have a cyst that is formed by endometrioma cells. The endometrium, which is the inner lining of the uterus, sometimes can begin to grow outside of the uterus. And when they are found on the ovaries, they develop what we call endometriomas, which is a type of cyst that also occurs. And normally, when a woman has ovarian cyst, the cyst can be on one side of the ovary, or it can be on both sides. So we have those who have cyst on both the left and the right ovaries, or we have those who have cyst on just one side of the ovaries. The other thing too is that there is a type of cyst we call polycystic ovaries. This type is where you have very small ovarian follicles which are clustered within a particular ovary. that can also happen to both ovaries, or it can be on one side. So we have those who have bilateral polycystic ovaries, and this normally has to do with hormonal imbalance and other various conditions that may lead to the formation of this cyst. There are various indications that may show if somebody has ovarian cyst. One is that if there is pain in the lower abdomen. Some women tend to have pains sometimes when they are having their menses, very painful menstruation, which can be an indication that there may be a cyst that has occurred. And sometimes you have pain when you are visiting the toilet, or you are passing stool. You have pain in the bowel due to an ovarian cyst that may be enlarging. Sometimes it can give you nausea and vomiting and stuff like that. There are also those who may complain of abnormal menstrual flow when they have ovarian cyst. Sometimes they cannot predict their menstrual cycle because their cycles sort of become irregular, and so they may have irregular menstrual flow when they have ovarian cyst and all that. The other thing too is that when you have ovarian cyst, sometimes there are those who may complain that when they have intercourse, they feel pain, during intercourse. That may be an indication that there may be an ovarian cyst present, or there may be something else that may be causing it. When you have ovarian cyst, there are various diagnostic features that are done. First of all, we can do a diagnostic scan to check the ovaries and see which type of ovarian cyst it is, because there are some ovarian cysts which may not be ovarian cysts, but they may be ovarian cancer, depending on the age of the woman, and then sometimes other factors that we also look at. And so there's a diagnostic ultrasound scan that is done to find out what type of cyst it is. Is it a functional cyst, which is a normal cyst, or is it a corpus luteum cyst, which is also a normal cyst that may be supporting pregnancy, if there is pregnancy, and all that. So when somebody has ovarian cyst, we want to find out if the person is pregnant. We want to also check the hormonal level to see if there's hormonal imbalance, because sometimes the presence of an imbalanced hormones can also lead to ovarian cyst. And then sometimes we want to check if there is also an infection, because when the ovaries are infected, sometimes they can also cause cystic lesion within the ovary, which can also give certain presentations like pelvic pains, heaviness within the abdomen, sometimes tenderness in the breast, and all that. And then sometimes there is painful menstruation, sometimes there is waist pains and all that. But once a diagnostic ultrasound is done, it can be diagnosed, and then the treatment can be given to you so that whatever the problem is can be solved. My name is Dr. Fiao from the Zoe Fertility and Alternative Medical Center. We'll come your way again and then discuss various health issues that may be of concern to you. Thank you.
What is the state of your health? Do you have a case of male or female infertility? Have you been told you have a low sperm count? Do you have a prostate problem? Are you a lady suffering from abnormal menstrual problems? Never worry again. Zoe Fertility and Alternative Medical Center has all the answers to your health needs. At Zoe, we treat all kinds of health problems, including erectile dysfunction. Zoe Fertility Center has a state-of-the-art laboratory and an ultrasound scan services available. There's also the total body scan, which scans all your organs in 5 minutes. Yes, you heard right, in 5 minutes. Our pharmacy is well stocked with good and highly efficacious natural medicines, all without side effects. Locate Zoe Fertility and Alternative Medical Center at Adenta New Site, behind the CAF International School, opposite Mechanical Lloyd on the Adenta Ebri Road. At Odoko, we are near Nicolisi Hotel, behind International Needs, Odoko Terrazzo. Call 0205 363614 or 0243 239534. Zoe Fertility and Alternative Medical Center, excellent healthcare, our hallmark.